Hi everyone, it's me, Sandy Cruz of Sandy K Nutrition, Health and Lifestyle Queen. For years now, I've been bringing to you conversations about wellness from incredible guests from all over the world. Discover a fresh take on healthy living for midlife and beyond, one that embraces balance and reason, without letting only science dictate every aspect of our wellness. Join me and my guests as we explore ways that we can age gracefully with in-depth conversations about the thyroid, about hormones, and other alternative wellness options for you and your family. True wellness nurtures a healthy body, mind, spirit, and soul. And we cover all of these essential aspects to help you live a balanced, joyful life. Be sure to follow my show, rate it, review it, and share it. Always remember, my friends, balanced living works. Hi everyone, welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have Dr. Eric Osansky, and we're going to talk all about the thyroid, one of my favorite subjects. The reason I love this subject, obviously, is because I had thyroid cancer at age 41. I'm now 55, and I am gone through menopause without a thyroid. We're going to talk about the connection between menopause, perimenopause, and the thyroid gland. Listen, you guys, you can follow only what one doctor says, or you can do a lot of research yourself to optimize your wellness. I can speak from experience that had I not researched all these different things about the thyroid gland, I would not be as vibrant. I would not be as, let's just say, fit. I would not be aging well if I didn't optimize thyroid function. So this is a really important episode. I ask that you share it with whomever you might feel would find it useful. I'd ask that you share it on your social media or anywhere that you can share it. It's much appreciated, and it really gives back so that I can keep having incredible guests like Dr. Eric Osansky. I have written my Essential Thyroid Guide. This is a patient advocacy guide. It is not a clinical book. There's enough clinical books out there if you want that. What I have written is a very simplified guide for those of you who just want, like the Coles Notes, you don't want to have a clinical understanding of your thyroid gland. It is available on Amazon everywhere. Follow me on all of my social media channels. It's Sandy K Nutrition everywhere. If you want to know more about the things that I write about, I am on Substack. So follow me there. I write short, explorative essays that relate to wellness, body, mind, spirit, soul. And the reason I write these explorative essays is not to dictate and tell you what your health is, because I really don't believe in that. I believe that health is so bio-individual, but unless you have people who are kind of giving you those breadcrumbs, you're never going to know where to look. I'm not a big fan of what's happened in this wellness industry where it's almost become a dictatorship. Like, you must do this and you must do cold plunge and you can't eat oxalates. And it's just like, I'm so tired of all of this because you can't make blanket statements like that for everyone. So follow me on Substack. It's sandycruz.substack.com. Follow me on my podcast wherever you're listening. Be sure that you're following because I come out with a new podcast each and every week on Mondays. And also for those of you who are in business, you have a small business and you're doing incredible things and you're really trying to scale up your business. I've joined forces with my husband's company, and I am now the brand manager of the health and beauty channel for TKG Partners and Ripple Distribution. This is a sales and distribution company, and I really want to bring better brands to more people. It was just such a beautiful synergistic move for me to do that. Sandy K Nutrition stays, but I have access to a lot of amazing brands that not many people know about unless you're in the space that I'm in. So if you do have a brand and you are ready to scale up and you want to go into the Costco's, the Best Buys, here in Canada, we have The Source. We have so many, and Walmart Canada. Please get in touch with me, Sandy at tkgpartners.com or Sandy at sandyknutrition.ca. And now let's cut on through to this amazing interview with Dr. Eric Osansky, all about thyroid. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today, we are going to be talking about one of my favorite subjects, and that is the thyroid gland. I have Dr. Eric Osansky, who brings over 15 years of chiropractic care, functional medicine, and nutrition expertise. After achieving remission from Graves' hyperthyroidism, we often talk about hypothyroidism. So this is, maybe we'll get a little bit into the hyper side as well. And he had Graves in 2009. He has dedicated his career to empowering others to address thyroid and autoimmune conditions naturally. As the published author of Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, Hashimoto's Triggers, and the Hyperthyroid Healing Diet, he shares actionable insights and evidence-based strategies. Now, today, we're going to talk about how to support your thyroid gland throughout perimenopause and menopause when many women see changes in weight. Is thyroid a part of this cascade of weight gain? You have to stick around to the end of the conversation to find out, but we're going to talk about a few different causative factors. Of course, thyroid is going to be the center of this discussion, and I'm really excited to have you here with me today, Dr. Eric. Welcome.
Sandy K, thank you so much. Really excited to be here.
Great. So I kind of gave a tiny little segue on why you have such an interest in thyroid health, but tell us a little bit about your background, because Graves' disease is not as often talked about. So maybe give us a background of your history and how you got into thyroid health.
Sure. So, and you're right, Hashimoto's is definitely more common, a lot more, and as a result, a lot more practitioners focus on Hashimoto's. And so, as you mentioned, my background is a doctor of chiropractic, and I had a traditional chiropractic practice for approximately 7.5 years. And then in late 2007, I was a little bit overweight. I was around 182, wanted to be like around 165, 170. So I was looking to lose some weight through dieting, detoxifying, exercising, and it was successful losing weight. Little did I know some of that weight loss, a good amount of that weight loss was due to the hyperthyroidism. But I actually didn't find out until one day I was walking around a retail store, a Sam's Club. They had one of those automated blood pressure machines. And I took my blood pressure, which was normal, but my heart rate was 90. And I thought maybe it was just from walking around. So I manually took my heart rate the next few days, and it was anywhere between 90 and 110 beats per minute, which definitely on the higher side. So I was putting the pieces together a little bit, and eventually I mentioned how my goal was to get to 165, 170. I was down at one point 140, so I lost 42 pounds of weight, and went to a primary care doctor. and the primary care doctor diagnosed me with hyperthyroidism, and then eventually went to an endocrinologist, and endocrinologist diagnosed me with Graves' disease. And at that point, I didn't have any experience with hyperthyroidism, with Graves' disease. But as a chiropractor, we have to take our CE credits. So for our continuing education credits, I would always take nutritional courses or functional medicine courses. And there were a couple on functional endocrinology. And while they focused more on hypothyroidism and Hashimoto's, they did talk a little bit about hyperthyroidism and how you could manage it naturally in some cases. And just like anything else, there's an underlying cause. So I knew I was going to at least attempt to try to do things naturally, take a natural approach. Had no idea if it would be successful, but I figured I had nothing to lose by giving it a try. And so, yeah, long story short, I started taking a natural approach, changed my diet, my lifestyle. Stress was a big factor, and was able to restore my health. And since 2009, I've been also helping other people with thyroid, autoimmune thyroid conditions, more so people with hyperthyroidism and Graves' disease, just because of my personal journey.
I want to clarify this because for anybody who's starting to pay attention to the thyroid gland, meaning their doctor maybe told them something was off, or maybe they have some symptoms, whatever it is, a lot of people don't understand what the metrics are. And TSH is, you know, listen, I'm not knocking our doctors because it's not their fault, but that seems to be the only thing they test. And it's not even the thyroid hormone itself, it's a pituitary signaling hormone for your thyroid to actually make the hormone. Could you explain high TSH versus low TSH? What is hyper? What is hypo for everyone?
Sure. So, with, as you mentioned, TSH, thyroid stimulating hormone, is secreted by the pituitary gland and it communicates with the thyroid gland. In the case of hypothyroidism, where you have low thyroid hormones, and T4, T3 are the main thyroid hormones. And so when they're low, the TSH tells the thyroid gland that, hey, we need to increase thyroid hormones. So you have higher amounts of T3. In the case of hypothyroidism, typically elevated levels of TSH. And with hyperthyroidism, you have the opposite. So with hyperthyroidism, you have elevated T4, T3. So elevated thyroid hormone levels. So pituitary wants to say, wait, hold on a sec. We have way too much thyroid hormone. So we're going to the TSH needs to be really low because we don't want to signal to the thyroid gland to produce thyroid hormone. So typically with Graves' disease, for example, not only is TSH low, but many times it's undetectable, like less than 0.001, or depends on the lab, might be less than 0.005. But either way, there's a less than, because again, it's not detectable because it doesn't want to secrete any TSH. So those are the main differences. I don't know if you want me to talk about the different antibodies associated with Graves and Hashimoto's as well.
Um, uh, no, well, maybe we'll get into it, but I think it's important to note that basically, very, very simply, if you have a TSH that's low, then that means you're closer to hyperthyroidism. So that's like everything is sped up. If your
Yep.
TSH is high, then that actually means the opposite, where everything's like slowed down. You might feel sluggish and tired. And this is why it gets so confusing for a lot of people. But I mean, Eric, I've lived in both states and it's not fun. And really, it's that whole Goldilocks theory where you want to have the thyroid gland just right. And it's different for everybody. Like your right may not be the same as my right. And this is probably where it can be a big miss with Western medicine because I know I personally always feel pretty good at about a 1.5 TSH, but I've been at that undetectable state, as I know you have, because after thyroid cancer, they said they had to suppress my thyroid function to ensure that the thyroid cancer didn't grow back. I don't think they do that anymore, though. Do you know if they still do that? I don't know if they do.
Yeah, good question. I can't say I deal with a lot of thyroid cancer patients, so I don't think so either, but I can't say a lot from a self-experience. Most people are seeing me, they're trying to, those with hyperthyroidism Graves' disease, they're trying to prevent the surgery. Usually once they get the surgery, every now and then I'll get a patient, but very rarely am I seeing someone who actually went through thyroid surgery or had, especially someone who had thyroid cancer.
For somebody who's got Graves, so hyperthyroid, um, they're sometimes they have to get to a point where they ablate the thyroid. They basically destroy it, right? They don't necessarily remove it, like physically remove it, like they did with me. But with Graves or hyperthyroidism, if it's not controlled, they ablate the thyroid, don't they?
Yes, they have what's called radioactive iodine, which pretty much it, like you said, ablates or kills the cells of the thyroid gland. And so, yeah, the goal of that is to, I mean, in a perfect world, like it's funny with cats are more likely to get hyperthyroidism than hypothyroidism. And I had a number of years ago a veterinarian as a patient, and she said with cats, they try to get them euthyroid, which means they have like normal thyroid levels, but it, it would make sense to try to do that with humans too. But more times than not, the radioactive iodine is essentially doing what the thyroidectomy is doing, which is making them hypo. Now, sometimes they might not get a high enough dose of radioactive iodine. So I do every now and then, there'll be someone who gets radioactive iodine, they'll become hypo temporarily, and then they'll become hyper again just because it didn't kill off enough cells. And then they might end up getting another round of radioactive iodine. It depends. Sometimes I've had a few patients who received radioactive iodine and became hyper again. And then they came across my stuff and my information. They're like, you know what? I don't want to get radioactive, another round of radioactive iodine. Let's see if we could save the thyroid. But more times than not, it does end up causing like long term, if not permanent, hypothyroidism.
So I guess we should, I kind of started jumping around there, Eric, because like this is like I'm trying to pack as much in this 1 hour. But I think it's really important to describe because when I had thyroid cancer, I literally did not know what a gland was, thyroid gland. I had no idea on how important this little butterfly gland is. Can you just give everybody a rundown of what the thyroid gland is responsible for?
Yeah, of course. So, I mean, you mentioned metabolism, like with hypothyroidism, it slows everything down. And that could lead to lower heart rate, that could lead to coldness, that could lead to constipation. With hyperthyroidism, it speeds up everything. So I mentioned I had an elevated resting heart rate, had heart palpitations, I had tremors. A lot of people have loose stools, anxiety, insomnia, the bones, so it affects bone health. So more so with hypothyroidism, low thyroid affects more bone quality. With hyperthyroidism, more bone density. So, like if you have elevated thyroid hormone levels, it increases the bone turnover, and that you're more likely to get osteopenia, osteoporosis over time, especially if it's unmanaged. Cholesterol, so cholesterol metabolism, if you have low thyroid hormone, a lot of times you'll see elevated total cholesterol on a lipid panel, elevated LDL. Hyperthyroidism, many times we'll see the opposite where cholesterol is low. So like I don't like to see, like we talk about cholesterol being too high. I don't like to see cholesterol too low. So sometimes I'll see a total cholesterol of like 120, which to me is too low. But again, it's related to the hyperthyroidism in the patients that I see. Thyroid hormone is important for brain function, digestive function, hair growth. Again, hair loss, very common with both hypo and
Yes,
hyperthyroidism. Yeah.
absolutely. And that's a misconception. People think that you only lose your hair if you're hypo. That's so not true because on both ends of the spectrum, I had significant hair loss. Like I'm talking, and here's what's really interesting. I was not even classified as hypothyroid. But Eric, as soon as my TSH goes over about 2.5, I start to have lingering, I call it subclinical hypothyroidism, even though it's not classified as such, because I think you have to be over a 4.5 or a 5 to have subclinical hypothyroidism. This is why I'm such a big advocate, because think of it almost like you have a touch of hypothyroidism. You have a touch of hyperthyroidism if you get close to these ranges either way. And so hair loss, I mean, as soon as I get past 2.5, if I do, which I don't allow it to happen anymore. Um, I start to lose hair and I'm like, damn, like, I'm sorry, but there's nothing more disturbing than when you have clumps just falling out in the shower. So I think it's important to note that, some of these symptoms cross over and some of them cross over even with menopause.
Yeah, I mean that is true. I mean, thyroid has an impact on the sex hormones, and there could be overlap in the symptoms. You could have, like, for example, low estrogen and associated with menopause and get the hot flashes, night sweats, but then hyperthyroidism also causes heat intolerance, night sweats. So sometimes it could be confusing. Am I entering menopause or am I dealing with hyperthyroidism? And of course, you get overlap with hypothyroid symptoms as well: the weight gain, the brain fog, and again, is it the hormone imbalances or is it the thyroid? So it can be confusing at times.
Now, I don't know if this is anything like, I know that you're more focused on Graves, but
Mhm.
I do know there's quite a bit of research that's not often talked about how estrogen can affect thyroid function. Do you know anything about that stuff, Eric?
Yeah. So, I mean, it goes both ways. I mean, so, you need healthy thyroid hormone levels for healthy estrogen, as well as progesterone levels, and then also adrenals, which I know that's not part of this conversation, but healthy adrenals also important for healthy sex hormones. There's also estrogen receptors on the thyroid. So as a result, if you have if like estrogen decreases, thyroid function can also decrease. And then estrogen also plays a role in the thyroid hormone receptors. So estrogen can affect the sensitivity of the thyroid hormone receptors. So if you have lower estrogen, again associated with perimenopause and more so post-menopause, then again that could also lower thyroid hormones. So yeah, I mean there's also high estrogen for various reasons that we could talk about, but yeah, if you have low estrogen associated with menopause, that could also cause low thyroid hormone and hypothyroidism and lead to those low thyroid symptoms.
Yeah, I know the research that I did, it's again, like I swear, it's everything is about balance. This is life. As soon as things get out of balance, that's when we can start to have problems, because I've read the same research that you're talking about really high estrogen can affect the thyroid and really low estrogen can affect the thyroid. So this is why when we kind of get into that. I know a lot of women who are estrogen dominant, and even though technically they may not have really high estrogen, but it is high in relation to progesterone. So, um, that they have problems with thyroid even in their 40s. A lot of women are estrogen dominant in their 40s, and then boom, they hit menopause and they're in their 50s, and then their estrogen goes down, and then their
Mm. Yep.
thyroid function goes off again. So, this is why it's really important to have practitioners who kind of look at everything. Like the hormonal endocrinology system doesn't work in silos. Would you agree?
Yeah, definitely would agree. And what makes it even more complex these days are the xenoestrogens, the endocrine disrupting chemicals. So it's not just our natural estrogens, but the xenoestrogens can also bind to the thyroid receptor, mimic, both mimic estrogen and also disrupt the thyroid. So yeah, I mean, when you when you factor that in combination with our natural hormones, it gets really complex, or can get really complex.
Yeah, back when this was actually way before I had thyroid cancer. This would have been after the birth of my second child. I started to research what these xenoestrogens did. And the reason I did was only because she was a newborn. She had such bad eczema. And so I was trying to figure out, okay, well, what can I do? This is going back when I was 35 years old. And I didn't, back then it wasn't as easy as now. Now we have lots of options that are phthalate free, that are BPA free. I mean, geez, like my sister and I were just talking about how we would warm up the baby bottles in plastic in the microwave. And I'm like, oh my God, like what I used to do. But we didn't know any better. But I did know about perfumes and scents and phthalates and SLS. I started to research it. So I think it's important to know that a lot of this might relate to your own genetics and your ability to detox these chemicals. Would you agree?
Yeah, no, without question, definitely agree. Everybody's different. And I mean, you could do a test like the Dutch test that looks at how you're metabolizing the estrogens. And yeah, there are some people that, like you said, there's definitely genetic components. And because of that, some people do a really good job of detoxifying the estrogens, even if they're exposed to a lot of those xenoestrogens. Uh, and then there are other people who they don't do as good of a job, and it will have a greater impact. So, and you could, the good news, you can do, even with the genetics, you can do things to support estrogen metabolism. You could eat more cruciferous vegetables, eat more broccoli sprouts. If you have to take supplementation, something like DIM or diazoxide methane, depending on the situation, if someone has low estrogen levels, they probably don't want to take DIM. But yeah, so I definitely agree with you, Sandy.
Yeah, I've been taking sulforaphane for many years now.
Mm-hmm.
And it's just there's calcium D-glucarate, there's DIM, diindolylmethane, there's sulforaphane. You have to figure out, and I agree, the Dutch test is a great way to figure out which of these substances that are natural supplements can help you to detoxify, because some are better at phase one, some are better at phase two detoxification. And, I know for me, the sulforaphane is very protective. It just it's almost like it's redirecting that estrogen to go down a healthier pathway.
Yeah, I agree. A lot of people do well on sulforaphane, especially if they can't take the DIM. And then you mentioned the calcium D-glucarate. So you could do a comprehensive stool test, see if you have elevated beta-glucuronidase levels, which might indicate that you have problems with estrogen metabolism related to the gut. And then therefore the calcium D-glucarate might be an indication in that case. But yeah, how long did you say you've been taking the sulforaphane for?
So I'm gonna say I'm 55. I probably started at around 49, something
Okay.
like that. Because DIM, I found just kind of like you actually pointed to that DIM may not be great for a woman who's close to menopause because it can almost it's like you're detoxing too much of it. That's actually what happened to me. And what I needed was more of the support of making sure it was metabolized in a healthier way.
Yeah, I agree. And I was guilty of giving DIM for even those who had low estrogen in the past. I didn't know better. I think it was Dr. Carrie Jones who I learned about, who she was talking about the sulforaphane. If they have if they have low estrogen, you don't want to give DIM. You want to go with sulforaphane if the estrogen levels are normal, or obviously if they're high. But even if they're normal, but you have the high estrogen metabolites in the Dutch test, specifically the 4-hydroxy or the 16-hydroxy, then that could be an indication for DIM.
I think that this is a good second to pause because a lot of women who listen to my podcast are in and around menopause, past menopause. You know, I know we're talking about the thyroid, but all of this connects. Like, even though when we get our blood work, we're going to do a panel for thyroid, we're going to do a panel maybe for our sex hormones, but it really needs to be looked at by somebody who can look at all of it together. Would you agree?
Yeah, I mean that 100%. I mean that's the downside of most medical doctors, including endocrinologists. Most endocrinologists, you mentioned, many of them just look at TSH, more so with hyperthyroidism. Usually they'll at least do a T4, a free T4, but maybe they'll do. In some cases, they will do the T3 as well. But yeah, they won't look at the sex hormones, let alone the adrenals. Try to bring up adrenal health to an endocrinologist. And again, they're endocrinologists. They should also have, I mean, not that they don't have the knowledge, but they don't pay attention to the circadian rhythm of cortisol. And you're absolutely right. They don't like you want someone that looks at a whole picture because even if they look at the estrogen levels, which they almost never do, or not just estrogen, but progesterone, testosterone, they're never going to look at the metabolism of these hormones. They're not going to order a Dutch test for you, unless if it's an integrative endocrinologist, which is rare. So yeah, I agree with you 100%. The gut too. I mentioned how the gut plays a big role in metabolizing, helping to metabolize estrogen as well. So if you have a lot of dysbiosis, a lot of imbalances in the gut flora, that also could be the reason why you're not metabolizing estrogen. So that's part of just also not looking, like you said, looking at the whole picture to see what, if you have a problem with estrogen metabolism, why are you having that problem?
Hmm. Now, the thyroid is okay. I'm going to just kind of go back a little bit. I think it's really important to note that sometimes that we have a lot of stress going on in our lives. It's very difficult to mitigate the effects of stress on our bodies. But stress is good in little spurts. And I always like to look back because to me, when I look logically at wellness, I look at more or less like a Paleolithic lifestyle. What did they do back then? Or I look at my parents who were farmers back in Croatia, like old country Croatia. How did they live? Well, sure, they had stress, but when you have prolonged stress, like we're talking, I don't know if you could put a time frame on it, but I did write, I am writing about this because I'm like, how stress affects me is different than how it's going to affect you. And my resiliency might be different than your resiliency. So you can't really put a time frame, but back when my daughter was sick, I was stressed beyond belief. And it was a long time. And then even before that, Eric, I had a spouse who traveled every week. I had a newborn and a toddler, and I was alone a lot of the time. And I'm like, okay, I can almost see what was going on, but I couldn't at the time. So I think it's important for women to see the symptoms and know how stress can affect this important little thyroid gland because now I don't have one. So, talk to us about how stress can affect the thyroid function.
Yeah, great question. I should start off by mentioning how stress was a big factor. I'm pretty certain a big factor in the development of my Graves' disease condition. And also it's important to mention I was in denial at the time. I didn't think I knew stress was a factor, but I thought I had good stress handling skills and did adrenal saliva test at the time. My adrenals were in the tank, my DHA was in the tank. But also the emotional, not just the emotional stressors, but the physical stressors. So I was overtraining at the time, and that also could impact the adrenals. But I mean, so there's a few different ways that stress can negatively affect the thyroid. So one is when you're dealing with prolonged chronic stress and you have cortisol, the body pumping out cortisol, adrenals pumping out cortisol for a prolonged period of time, that will affect conversion of T4 to T3. Again, T3, I don't think I mentioned earlier, T3 is the active form of thyroid hormone. And so it's important to have both T4 and T3, but T3, if you have low T3, that's really going to lead many times to those hypothyroid symptoms. So if you have prolonged chronic stress, that could lead to kind of like a state of hypothyroidism due to that low T3. Cortisol, chronic stress also causes dysregulation of the immune system. And so I think that's one of the factors in my health when I was or prior to dealing with Graves. And again, I also speak with people with Hashimoto's, and almost always stress. It doesn't matter if it's Graves, Hashimoto's, even non-autoimmune thyroid conditions. But in this case, when talking about Graves, Hashimoto's, we have dysregulation of the immune system. It leads to increase in pro-inflammatory cytokines, which promote inflammation. And that also is a potential mechanism of how stress will affect the thyroid by impacting the immune system, because most of the thyroid conditions around, most hypothyroid conditions are Hashimoto's, and most hyperthyroid conditions are Graves' disease. And then stress also decreases secretory IgA. Secretory IgA lines the mucosal surfaces of the body, including the gastrointestinal tract, and serves as protection. It's not a specific leaky gut marker, but I mean, there are other more specific leaky gut tests. But typically when secretory IgA is low, usually someone has a leaky gut, and that is part of what's called the triad of autoimmunity, or the three-legged stool of autoimmunity, which is again a factor in the development of autoimmune conditions, including Graves and Hashimoto's. And so those are a few different ways in which stress, the first one that I mentioned, is more of a direct mechanism of affecting that conversion of T4 to T3. But to me, the biggest concern is the impact of stress on our immune systems, and really, along with other factors, of course, are like increased toxic burden. But again, stress is higher than it ever has been. And just, that really, I think, is a big factor in the increased prevalence of autoimmune conditions such as Graves and Hashimoto's.
I always think the body is just so brilliant, and it's like it knows. It always wants to look for that. Okay, how can I feel safe? How can I feel good? And when you're in that constant stress, like, you're like tight and you're wired, and you're in that state for a long time, it's like your thyroid gland's going to go, okay, I better slow down. And so that's why you'll sometimes see that TSH go up as well. It's like a reaction to saying, I need to preserve all hands on deck, right? Let's preserve bodily functions. Let's slow everything down until Sandy calms down. Like I'm just a big believer that the body is just so intelligent and knows how to react until it doesn't know anymore what to do.
Yeah, you're right. Actually, and we didn't bring up when talk about the markers. There's a marker reverse T3 that kind of looks at that when you have like elevated reverse T3, that's the body's way of like trying to slow things down. And I mean, we see that with hyperthyroidism. I don't test reverse T3 anymore because everybody has elevated reverse T3 levels because of the elevation in thyroid hormones. But you're right. I mean, the chronic stress could also play a big role, which is why if someone has hypothyroidism, including Hashimoto's, it's a good idea to look at that reverse T3, which again, that's the inactive form of thyroid hormone, whereas T3 is the active form that I mentioned earlier.
Yeah, and here that's not in Canada, that's not even a measurement. Reverse T3, never done. Even
Mm-hmm.
I have an endocrinologist, he's great. He does all the markers, for antibodies, free T3, free T4, TSH. He does thyroglobulin, which is really important if you've had thyroid cancer, to make sure that there's almost no thyroglobulin. And then but reverse T3 is never done. And the way, like, I love this analogy. I've been using it. I don't even know. I must have heard of this over 10 years ago. That the way a good way to think of reverse T3 is, back in the days when we used to go to the bar and there would be all the bouncers at the door and they'd be blocking the doorway. Well, reverse T3 are the bouncers at the bar, but to your cells. So it doesn't let hormone enter your cells.
That's a pretty good analogy.
I know. I always like to look back to my youth, It's okay. It's okay to do that, right, Eric?
Yeah, definitely.
So we've talked about stress. We've talked about our sex hormones. Let's get into nutrients. Here's a question for you because you're an expert on hyperthyroidism.
Hmm.
Is too much iodine um, a, like something that could exacerbate hyperthyroidism?
Could be. I was waiting to see if you'd get into the iodine question, and I because a
Yeah, we
lot of
will talk about it for sure. But
yeah, a lot of controversy with iodine. So yeah, I mean, to answer your question, too much iodine can be problematic. It can potentially increase hyperthyroidism. It can, I mean, in some cases, exacerbate the autoimmune response. And we're not just talking about iodine supplementation. I have a podcast episode on iodine contrast agents that, again, that's also a concern as well. So if someone has hyperthyroidism, they definitely don't want to receive like a CT scan with iodine contrast, but they also want to be careful with iodine. And but there's also, it's interesting because in the I mean, both really, not just the hyperthyroid world, but there's different perspectives. There's the high iodine perspective, meaning that people should supplement with high dose iodine. And then there's the other perspective where you want to just stay away from iodine. And I
if
mean,
you're
there's also,
hyper, you mean if you're hyper, right?
I'm talking about both. No, I'm talking about both. I'm talking about there. If you're, there are practitioners out there that recommend high dose iodine for hyperthyroidism as well as for Hashimoto's. And the reason I know is because years ago I actually took high dose iodine, just and it didn't make me more hyper, but again, when I mentioned I was taking those functional endocrinology seminars, now they were talking about natural ways of managing the symptoms through herbs like bugleweed, motherwort, which you might not be familiar with, but those are like alternatives to antithyroid medication and the beta blockers. But high dose iodine actually can have the opposite effect and block thyroid hormone if you take really high doses of iodine. Now, again, I'm not recommending to take that. I've actually I've been definitely more conservative over the years with iodine. I'm just saying years ago, I was taught by some of these seminars and other practitioners that you do want to give iodine in people, not just with Hashimoto's, which again, now there's also concern with Hashimoto's and iodine, but in those with hyperthyroidism. And so when I first started helping people with thyroid and autoimmune thyroid conditions, including hyperthyroidism, I would do urinary testing for iodine. And then if someone was deficient, would recommend separate iodine supplementation. And without question, I saw in some cases where it backfired and it would either exacerbate the hyperthyroidism or rarely, but a few cases, there's in Graves' disease, it's what's called thyroid eye disease, where the immune system attacks the tissues of the eye. So again, in some cases, the iodine can exacerbate the autoimmune response and worsen thyroid eye disease. And that's scary. And it's not a good feeling when someone says, I've taken iodine, like supplements with iodine, and now I'm feeling like more pressure in the eyes. And so even to this day, there's controversy. I mean, I just saw on Substack like a few weeks ago, a practitioner talking about how you want to take high dose iodine and it's important to supplement separately with iodine. And then there are, like I said, other perspectives, including some people have been on your podcast who recommend the opposite, like Dr. Alan Christensen, who has a book, The Thyroid Reset Diet, and he recommends the opposite. So I'm trying to be somewhere in between. I don't recommend like completely avoiding the iodine, but I am cautious when it comes to like just taking 25, 50 milligrams of iodine Yeah, and you're right. With hyperthyroidism, and also even in Hashimoto's can cause problems. But like I said, you talk to 10 different practitioners, and practitioners who have a lot of experience with the thyroid, you'll still get different perspectives as far as who should take iodine, who should avoid iodine. But yeah, I will say I've been on this both sides of the spectrum, and yeah, just over the years I have become more cautious with iodine. Again, not telling people not to have any iodine in their food and things like that. I think that's a little bit too extreme. But yeah, so we could talk more about this, but it's again, it's like I said, it's definitely a controversial topic.
I think it's a massive topic, and I think there's massive discrepancies. And I remember doing an iodine loading protocol. This was, and I don't have a thyroid, but it was more so people don't realize that iodine's not important only for thyroid. It's important for women for breast health. It's important for the brain. It's important for a lot of other bodily functions. But I think, I always go back to that whole Goldilocks theory that too much is not a good thing. So it's really hard because I don't even know, like, is there's some controversy about urine testing for iodine, isn't there?
There is. I mean, there's really no consensus when it comes to testing for iodine. I mean, the blood test probably isn't too accurate to do like serum testing, but then there's different types of iodine testing. So, like you, I did the 24-hour iodine loading test where you take a 50 milligram tablet of iodine. This was years ago that I did that test. And then you look at the excretion of iodine. And then there's just basic iodine tests, like just a spot test. We just do where you're not consuming any iodine, you're just doing a test and seeing how much iodine's in the system. And so again, either way, there's not a lot of research out there. And the thing with the loading test, again, I've had a lot of patients over the years, especially the first number of years I was in practice, do the loading test. And again, most people honestly seem to do okay, but there is still risk, especially again, like you mentioned, the hyperthyroidism, taking the 50 milligram tablet of iodoral, before doing that test. But yeah, so like I said, I mean, if I see a urinary, the iodine loading test, there's not really anything as far as I know in the actual research. Like if you go on PubMed, urinary iodine testing, there is some. And I mean, if someone, I definitely pay attention to it. I mean, if someone does a urinary test and they low in iodine, again, I'm not going to say, okay, let's go and take large doses of iodine, but I would want to make sure that they are getting some iodine and that they're not trying to, because again, there's even endocrinologists are sometimes will tell the patients with hyperthyroidism to avoid all iodine. And again, it makes sense on the surface. You need iodine for formation of thyroid hormone. So let's avoid completely all the iodine if you have hyperthyroidism. And for some people that does work. Like some people, I spoke about this in my book, The Hyperthyroid Healing Diet. There are some people who do better on a really low iodine diet, especially many people with hyperthyroidism, but there are people who do fine, again, as long as they're not overdoing it and not like overloading, eating like a lot of really high iodine foods like kelp, for example, is like one. But I don't tell people to avoid like all food sources of iodine, even if they're dealing with hyperthyroidism.
Isn't fish too, like fish, seafood, anything like that is going to be having a decent amount of iodine. I know kelp and like seaweed. You can buy the seaweed. They're gross. I've tried them. I can't do it. But I will do tiny little doses. And again, we're not giving any medical advice here because you're going to have to speak with your own practitioner on what's right for you. But for me and my family, because we don't eat a lot of iodine rich foods, like we're not big seafood eaters, fish, kelp. So I'll
Neither am I.
sometimes no, like what I do is iodoral, iodoral. I'll take like there's like the tiny little doses. What is it, like 6 milligrams or something like that? And I'll just pulse it in like once or twice a week just to make sure I have a little bit of iodine, just to
Yeah.
be safe.
Yeah, and again, you're rotating it, so doing it a few days a week. But yeah, I mean, you're right. I mean, you are getting some iodine if you eat eggs, if you do eat dairy, which again, people who are, I can't say I never have dairy, but it's limited. And those who I work with usually are taking a break from dairy while healing, so they're not getting iodine that way. So you're right. The fish, the seafood, the shellfish is especially higher in iodine. I mean, if you're eating like wild salmon, you're usually not going to get like a lot of iodine. So but if you're not eating any fish, you're right. If you're really not eating seafood, again, you'll get some from the eggs you eat, and if you eat dairy. But if you're dairy free, not eating seafood, you very well might not be getting enough iodine, even if you're eating eggs.
Here's a question. Goiters. Goiters, so it's like the enlarged gland or nodules. Isn't iodine deficiency one of the causes of goiters?
One potential cause, yeah, goiters, there could be numerous causes. So, like when I dealt with hyperthyroidism, I had a mild goiter, but it was due to when you have too much thyroid hormone, that can cause a goiter. When you don't have enough iodine, and that could lead to hypothyroidism, which could also cause a goiter. So you're right. That's one factor. What's interesting, estrogen metabolism, like getting back to estrogen, problems with estrogen metabolism could also be a factor with goiters as well as thyroid nodules. So getting back to tying the estrogen in with the nodules and the goiters, insulin resistance also could be a factor. Just inflammation in general. So yeah, I mean, it's definitely a potential factor as far as iodine deficiency. And when you're looking at someone with a goiter, you want to look at everything. You want to consider like what could be the cause. Is it iodine deficiency? Is it inflammation? Is it insulin resistance? Is it problems with estrogen metabolism? So yeah, but iodine deficiency is definitely one of the potential causes of a goiter.
Now, there are other really important nutrients for healthy thyroid function. Do you want to? I know vitamin D is like big for any autoimmune. I did a whole show on autoimmune conditions, and I mean, vitamin D is so critically important. And it's really, I don't know how it is in the US, but here in Canada, it is not paid for. Like we have OHIP in Canada, so it's social whatever, social health care. And it's not paid for unless there is an actual reason to test for it. So I can get mine tested probably for free because I don't have a thyroid gland. Maybe. There's these little boxes that need to be checked, kind of thing. But it's not common to test for it in Canada. And I'm like, it is so important to be in a healthy level of vitamin D, even as a preventative factor, one preventative factor for all autoimmune diseases.
Yeah, no, I definitely agree. It is crazy for them not to. I mean, because again, even in sunny places like Arizona and Florida, you have people who are vitamin D deficient. But then as you go further up north, it's more common. I mean, pretty much it's widespread. If you go to Arizona, it's hot, but who wants to go outside when it's like 115 degrees? So they're still inside and not getting the sun exposure they need, or they're wearing sunblock when they're outside and not getting the benefits of vitamin D. Yeah, vitamin D, without question, important for optimal immune system health. And then, just like you mentioned, the thyroid, you got to consider lab ranges versus optimal ranges of vitamin D. I know in Canada they use a different unit of measurement, like nanomoles per liter. So, like here, like in the United States, you want at least 50. Some will say even like 60 to 80. Whereas, like if you make the conversion in Canada, it'd be like 50. I'm sorry, 125 like nanomoles per liter would be like the minimum that you want. But if you look at the reference ranges, I forgot the ranges, but some will say if you're like 75, you're good. You're good to go. But from an immune system, and maybe from a bone health perspective, possibly, but immune system standpoint, it seems that most functional medicine practitioners agree that the labs are way too low. Their lab ranges are way too low. So I supplement with vitamin D, D3 on a regular basis. You probably also know you want to make sure to take K2 to guide the calcium into the bone if you're taking D3. But yeah, so vitamin without for both Graves, Hashimoto's, other autoimmune conditions, vitamin D is important. Uh, Iron is another important nutrient when it comes to thyroid health. And it's one of those, like you mentioned, the Goldilocks with iodine. Same thing with iron. You don't want, I mean, a lot of people talk about iron deficiency, especially in menstruating women, even though, again, I see iron deficiency in men and postmenopausal women, which it's obviously not due to menstruation, but could be other factors. Maybe they're vegans, maybe their gut health isn't optimal, they have low stomach acid. So you don't want iron to be too low, but if iron's too high, that could cause oxidative stress and not which isn't good for the immune system. But iron is important for thyroid hormone production. So it plays a role in the enzyme thyroid peroxidase, which so yeah, you have low iron that could lead to low thyroid hormone levels. Zinc is important as well. Selenium is so much research with selenium and thyroid. Just conversion it could play a role in. But then again, immune system. There are a number of different studies showing that selenium supplementation could help lowering thyroid antibodies, those thyroid peroxidase or TPO antibodies, as well as even in Graves, those thyroid stimulating immunoglobulins can help with thyroid eye disease that I briefly mentioned earlier. So selenium, which is a precursor or is a cofactor for glutathione. So glutathione is the master antioxidant. So you need healthy selenium levels to have healthy glutathione levels. Vitamin A is important for immune system health, but also it's important to support the thyroid receptor. And there's a condition called thyroid hormone resistance, where kind of like insulin resistance. Insulin resistance, you have too much insulin, but it's not getting into the cell. That could happen in some cases with the thyroid hormones, where TSH is maybe normal on the higher side, but thyroid hormone levels on the blood test will also look higher. And the reason it's higher is because, again, you have that thyroid hormone resistance. And so in that case, you might need to do things to support the receptor. Zinc actually supports the receptor, but so does vitamin A. Tyrosine, which is an amino acid, is important when it comes to thyroid hormone production, which is why you see tyrosine in a lot of these thyroid support supplements. And so, I mean, all the nutrients are important. Magnesium is another one. I mean, but yeah, I mean, without question, the ones I just mentioned are one of the more important ones when you look at the research when it comes to thyroid health, thyroid hormone production, as well as helping with the immune system.
So, really, the bottom line is for anybody who's listening who's perimenopausal or menopausal, if you go on a diet that is heavily restricted of any particular food group, you may become deficient in these nutrients. I come from, a bit of a long history of avoiding certain foods, trying different diets, chasing my body pre-thyroidectomy. And I don't think it served me. And I think what serves me is eating a diet that is a variety of different whole foods and having different foods all the time, because then you're going to it's almost like you're going to make sure that you get those nutrients in the food that you're eating.
Yeah, I agree. I mean, some diets like ketogenic could be really restrictive, and again, not to say there's not a time and place for them, but you got to be careful because some people will be on keto for 6 months or a year, and that could also have a negative effect directly on thyroid. But as you mentioned, also you might not be getting the nutrients you need, and that also could affect not only thyroid but other areas. So I agree. We want whole, healthy foods, protein, of course. These days, a lot is out there about protein, and I agree. You definitely want to make sure you get enough protein. But I think the variety is really important too. If you're just eating three or four or five different foods, it's going to be hard to get the nutrients that you need.
Yeah, and I want to go back to the whole, this is really interesting, the stomach acid thing. And you mentioned iron. So I was always like on the cusp. My ferritin was low. There were times that my ferritin was like 8. It was really, really low. And I was in my 40s. I had had my thyroid out. I was put on a PPI, Eric. And so, I'm not going to get into all the details here, but I was told that because they told me I had Barrett's esophagus and that I had just had thyroid cancer. I was at risk for now having esophageal cancer. So I better take these. And I didn't even have heartburn at the time. So what I started to do, and it was probably when I went back to nutrition college. I started to fake my own digestion because I'm like, I'm on the way to becoming fully anemic if I don't do something. So I started taking higher doses of hydrochloric acid without any side effect, no heartburn, no issues, and I personally avoided becoming anemic. And I'm not saying that's for everyone because there are contraindications to doing this, like if you have ulcers or things like that. But I think it saved me. And it saved me from going down an even worse trajectory in health. So, for anybody who's listening, there are things that sometimes we can't help. Even you mentioned vitamin A is really important. Vitamin D is really important. I carry a number of genetic SNPs that make it difficult for me to convert and use those nutrients, even though I might be eating it, I might be taking it, I might be out in the sun, and then, that I was reading a research article, maybe you read this about how low vitamin D might be such a huge issue, even in the states where it's a little bit warmer and there's enough sunshine, because obesity can get in the way of absorbing the vitamin D, even if you're out there getting it or trying to get it. Have you heard that study?
I have not. I've not come across that study. So it's in obese patients or people who are obese, just the absorption of vitamin D is decreased.
Yeah. So,
Yeah,
I
interesting.
mean, it's just honestly, it's like a you can get into this vicious cycle of issues. Like, you're a menopausal woman, and then all of a sudden you're like, oh my God, I'm starting to gain weight. So I'm going to stop eating these foods, or I'm going to exercise my head off so that I can try and keep this weight off. But you don't realize that that's actually exacerbating your issues with stress. So it's like, how do you win? How do you win?
I agree. And again, I was guilty of that as well with the overtraining, at least. Just and also the dieting and detoxing. So yeah, you're right. I mean, you win by balance. I mean, balance is the
That's it.
key. Yeah.
I think that's it. I think that's it. I think as humans, it's harder to achieve that balance in this modern day life, especially when you know, you don't know what's in your food anymore. And anyway, I think the important thing is to remain balanced in choosing whole foods, organic when possible. And of course, there's always good, better, best with your food choices. And And then having a practitioner who understands the body as a whole.
Yeah. I again, we spoke a little bit about this earlier with looking at the whole picture. So yeah, obviously I'm biased because I'm one of those practitioners, but there are many out there. That's the good news. There are more and more functional medicine practitioners out there who do look at the whole picture. And I mean, the challenge is that many of them might not be on your insurance plan. So you might have to pay out of pocket. But again, to me, it's worth it going, I mean, compared to going to a doctor. And again, there's a time and place, obviously, for conventional medical doctors. I will say a lot of my patients with Graves are seeing an endocrinologist because some of them, even though I manage it naturally and a lot of my patients manage it naturally, some people do need to take the anti-thyroid medication. So again, that's the time and place to see the endocrinologist. And some people do need thyroid hormone replacement. So again, there's a time and place for the medical doctors. The problem is many times that's all they're doing. Just take the levothyroxine or whatever they're recommending. Sometimes maybe some Cytomel, but most of the time just Synthroid or another type of levothyroxine. And then with hyperthyroidism, just the three options are antithyroid meds, radioactive iodine, thyroid surgery. Yeah, diet doesn't make a difference. Stress doesn't make a difference. So you're right. You really do want to, all this does make a difference. I mean, what you put in your body is important, not just diet wise, but cleaners, cosmetics, the stress that we mentioned. I mean, the mold that works. I mean, all these things. And because of that, you do need someone who looks at the whole picture. And if there's anybody who not only just dismisses diet, but then there are some people that's all they focus on. Okay, you just eat a healthy diet and that's all you need to do. But again, unfortunately, so many conditions these days are more complex and you need to go beyond diet and lifestyle. That being said, if you don't incorporate the foundations, you're not going to heal. But yeah, so getting back to someone who looks at the whole entire picture, yeah, I definitely think that's not that's a it's a necessity if you're dealing with really any type of health condition.
So I would recommend anybody who's listening to this find a functional medicine practitioner who will, if you're going through perimenopause, menopause, who will even just begin with doing blood work that is all of it. So not just TSH, but what we kind of touched on it: TSH, free T3, free T4, antibodies. If you can get reverse T3, great. And then take a look at all the sex hormones as well, right? That's important too.
Yep. Mm-hmm.
Um,
Yes.
so in closing, how would you like to have anybody who's listening come find you? What are the best resources? And if there's anything that we missed that we didn't cover off that you'd like to talk about, please do so.
Yeah, I think we hit a lot. We hit a lot of information. So yeah, just as you said, Sandy, just important to find someone who looks at the entire picture. And I agree, just that even if it's just starting out with doing a comprehensive blood panel and not just doing the basics. I mean, the basics are important, but you want to go beyond the basics. And then also looking at it besides sex hormones, like adrenals, important. But again, maybe at first it's just looking at the blood test and then maybe you go beyond that eventually. But yeah, there's, I guess, three main resources I would say. One would be the podcast, Say My Thyroid, which I definitely would love to have you as a guest on that. So we'll be chatting again. And you could just visit Say My Thyroid on your favorite podcast platform or just type in saymythyroid.com. Second, my books. I have two books on hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease. Now it's in third edition, which came out in 2023, The Hyperthyroid Healing Diet, which is my most recent book from 2024. And then I have, for those who have Hashimoto's, I have a book called Hashimoto's Triggers, which is a really comprehensive book on finding and removing the triggers of Hashimoto's. And then I have a newsletter called Healthy Gut, Healthy Thyroid. And so you could check that out by visiting savemythyroid.com/newsletter.
That's great. Thank you so much, Eric. It was such a pleasure chatting with you.
Yeah, same here, Sandy. Really appreciate you having me on. And thank you so much. And yeah, I agree. This was a really wonderful conversation.
I hope you enjoyed this episode. Be sure to share it with someone you know might benefit. And always remember, When you rate, review, subscribe, you help to support my content and help me to keep going and bringing these conversations to you each and every week. Join me next week for a new topic, new guest, new exciting conversations to help you live your best life.